Hey guys, I'm Dr. Eric Gifford with 417 Sports Medicine and Orthopedics, and today I wanted to just give you a rundown of what we do here with regards to types of injections. I wanted to kind of show you what we have and what we utilize and how it works. The simplest injections typically involve some type of either a numbing agent like lidocaine or marcaine, and usually I use methylprednisolone, which is a intermediate acting or long acting corticosteroid. What that does is it's an anti-inflammatory that we can inject into joints or tissue areas that decrease inflammation. That's all it does. It just decreases the inflammation. It doesn't create any healing or regenerative effects. It just decreases the pain and inflammation. But in some cases, that's all it takes, and that's a very cheap, easy treatment, and we utilize it a lot in this practice. Other things that we have, this is called hyaluronic acid. This particular brand is called Gel 1. I like to use hyaluronic acid. It's available in the knees. It's not really approved for other joints. You can use it in other joints. It's just it won't be covered by insurance. But what this is it's synthetic joint fluid. That's the best way I think I could put it. And it provides some lubrication, some cushioning effect, but it also upregulates your body to produce more hyaluronic acid and healthy hyaluronic acid, which is, again, lubrication and cushioning. So this is very helpful as well. It's definitely more expensive, but we use it in the knees quite often. Then from there, I want to talk about regenerative techniques. So we got lots of different regenerative options. To start out with, this is a very simple PRP kit. So what we do is we take about 12 cc's of blood. It's just a test tube. It's got some anticoagulant in it. It's also got a little bit of a wax separator layer. And what we do is we draw that. We take the blood, we fill it up. We then take that in the centrifuge, spin it down, and we get basically platelet-rich or platelet-poor plasma, depending on how much you take out of it. And that concentrates those platelets. Then what that's doing is it is creating a healing response. It's creating a regenerative response. It's the same mechanism as when you get a cut or a laceration or say you had surgery. Well, what's going to create that healing in scar tissue is platelets. They're going to aggregate there. They're going to stop the bleeding. They're going to immediately start releasing growth factors and cellular signals that are going to create a healing response in your body, whether that be for new blood vessel growth, whether that be for fibrous scar tissue growth, and just in general to recruit those cells to help create that tissue healing. So this is the first step in that. It's a very economical usage of platelet-rich plasma. Then we go up to what we call our Y-cell PRP kits. It's going to give us a little bit more concentration. This is the test tube. I'm just going to handle this one because this is the one we use for balance as we have to counterbalance the centrifuge. But what it does is we draw blood into it, and then it gives you a little bit of a concentration area in this little area, and that's why they call it Y-cell, because it looks like a little Y, and that gives you your platelet-rich plasma. You can also draw off the top, which would be your platelet-poor plasma. There's various different uses for that. This is actually one that was already spun down. We already extracted from it, but I just wanted to give you an idea of what this looks like. The blood, the RBCs all concentrate below, and then you'll get this, what we call the buffy coat layer and the platelet-rich plasma trapped in the Y cell area, or Y area, and then the platelet-poor plasma up above. And then we go from there to the next step, which is the one I'm really excited about. This is called fluid flow. It's made by Biolab Sciences, and this is the one that's actually derived from placental tissue. So this is donated placental tissue. This is not aborted babies. This is not any type of in vitro or discarded embryos. This is just donated placental tissue at C-section deliveries. They're extracting growth factors from the placenta as well as the umbilical cord. It's very rich in growth factors. If you think about it, what does it do? It grows a baby in 9 months. It's remarkable what the placenta can do. And it's full of these growth factors and cellular signals that can create a tissue healing response. The exciting thing about this one is it's actually got a code that is covered by Medicare. So if you have traditional Medicare insurance, this fluid flow can be covered by your insurance, and again, that makes it attainable for a lot of people. for a lot of different uses, whether it be for your knee or your hip or your shoulder or a chronic tendinopathy like Achilles tendonitis or plantar fasciitis. There's lots of things you can use it for. But ultimately, I wanted to show you what we have. We have this on the shelf every day in clinic. None of this is had to be ordered specially. I mean, ultimately, if you come in and you want a treatment like this, we have it the same day. We can provide these services when asked for. So excited to offer, again, some of our regenerative stuff in addition to our traditional corticosteroid, hyaluronic acid, the traditional offerings. But excited to show this to you, and if you want to know anything more or have questions about it, again, we're happy to see you. You can call us, we can answer questions over the phone, but we'd love to see you in clinic and explain to you what options we think are most appropriate to help you get back in the game. Thanks. Bye.